Just as anticipated, we think that seems that due to this double mechanism has a additional effect. So we act in two different ways, and we hope that additional effect, a promising effect in this patient, with or without presence of mutation in cysteine 481. Okay, obviously we hypothesized our drug in the CLL mutated patient, obviously, because now there are this clinical urgency. Okay, pirtobrutinib in this moment as an hope, as an alternative way to overcome this problem. Obviously, there are some other mechanism, many other mechanism, and in particular other epigenetic mechanisms that very poorly investigated. And in general, despite there are reported different findings related to the possibility that some mutation in epigenetic players can be involved in the development of resistance, such as if, for example, the mutation in EZH2. Okay, it's reported present in a cluster of patients that developed resistant or has a very short remission. Okay, so this is a possibility to use also in this patient the different drug, because at this moment, if we see the state of clinical trial or the state of FDA approved drug, this is only one FDA approved drug for follicular lymphoma, for example, that able to we can use for the patients that have the mutation in zeta H2. Okay, and in which we have a relapse of disease. Okay, so our drug seems to open a way to use the epi drug in B-cell malignancies in general. Obviously, we propose for CLL, but we can provide the open way to the use of epi drug also in CLL, or the combining, because it is the only one drug in which we have a double activity, enzymatic inhibition and the epigenetic inhibition, epigenetic inhibition. So this is an important point in my opinion. Obviously, if I hypothesize also the timing, the sequence of a treatment. Okay, the possibility to use this drug in which time of a treatment of a patient. Obviously, I hypothesize not in the first step. I hypothesize the use of the covalent inhibitor as already approved in the first line of therapy. It's okay, but when the patient developed the resistant or refractory or developed the resistance to the treatment, I hope the use of our drug, the option and the choose of our drug is an option. Okay, is a good option, and in some cases I would like also to in another way I would like also to discuss it about the possibility to use our drug not only in monotherapy but also in the combination therapy, because I think that our drugs that as a BTK inhibitor obviously, but maybe in a combination with the immunotherapy, such as CAR T-cell or antibody anti-CD21, for example, or inhibitor of checkpoint PD-L1, for example, I think that it's a good option. Obviously, about this point, now we don't have a finding. We are in a prospective way. I would like to speculate about the possibility to use this combination. I don't have a result about this point, but I would like to speculate about this point, because if I see our results at this moment. An important point is the immunoability and of our drug, and to the combination of immunotherapy and our drug in a synergistic way maybe can be improve the effectivity, the efficacy of therapy in the patient. Maybe it is a speculation, but it's also an hope.